with them. And now it's my pleasure to invite AFTD's CEO, Susan Dickinson, up to the podium. Susan's worked with AFTD since its founding in 2002 and has been leading it since 2008. But today she's here focusing on our work over just the past year and on the future of FTD, specifically for the coming years 2019 through 2022. And so here to tell you more about AFTD's work and our new 3-year strategic plan is Susan Dickinson.
Thank you, Sharon, and thank you to everybody we've heard from so far today. It's a powerful day. It's not an easy day, but as ever, we can find comfort and, as Chuck says, hope by being here together. Quick question. Could I see a show of hands of for whom is this your first AFTD education conference? Oh, that's great. Well, welcome. Welcome to you. We're glad you found us. Welcome to our recidivists. We're glad you're back. And as Ben commented this morning, I want to give a special welcome to the people who are participating from home. It's a real thrill for me and for the rest of the staff that we can finally offer this live streaming option. In many ways, we realize it's those of you at home who might benefit the most from what you hear today. So thrilled to be here with you all. Let's get this right. That's number ready. So AFTD is a national 501c3 nonprofit organization. We were founded in 2002. We are staffed by 20 professionals who work with me in an office outside of Philadelphia, and we're led by an all-volunteer board of directors who come from across the country. Our motto is all FTD all the time. Our mission, as you see here, is to improve the quality of life of people affected by FTD and to drive research to a cure. We do this by engaging in a number of different kinds of activities. We fund research, we spread awareness, we provide support and information, we work to educate clinicians and healthcare providers, and we advocate for more funding for research and for better care and services for our community. I'm going to give you just a few highlights from the past year. I'm very pleased to say that we continue to reach more and more people every year with the information and support that we're able to provide. So in 2018, we had more than 230,000 visitors to our website. More than 15,000 people signed up to receive our newsletters and engage with us through social media. More than 2,200 people called or emailed our helpline. And this number is actually old. I learned last night, currently we have trained and support over 100 volunteer support group facilitators who run groups in 32 different states and also who run 8 phone or internet support groups, as we heard earlier, either for people who have a special focus on this disease or who live remotely and can't reach an in-person group. We continue to be able to fund more and more research every year. Currently, I'm very proud to say we have over $3 million out to funded researchers who are working in clinics or in the lab to better understand FTD. Here you see a list of the different kind of grant programs we run. We fund young scientists at the postdoctoral level. We have a big initiative to find those biomarkers that are going to enable us to diagnose people during life. We fund projects that develops new potential drugs. We just started a new program that's going to help us design clinical trials that are appropriate for rare diseases. As you might imagine, that's a bigger challenge than in a disease like cancer or Alzheimer's, where there are lots of people available. And I'm very proud to say that in 2018 alone, we had 55 scientists apply for our grant programs from 12 different countries. And as ever, we aim to fund the best science worldwide. And I'm also really proud to say that I'm seeing us be able to have a broader influence throughout society in having people understand that not all dementia is Alzheimer's. And as examples of this, this year for the first time we had people and partners in 25 different countries participate in World FTD Awareness Week. We are seeing an increasing number of biopharma companies engage with us. And I'd like to give a quick shout out to 3 of our sponsors, Ionis, Elector, and Biogen, whose representatives are all here today. They have been working with me and my staff for the past recent years to understand what FTD is like, to understand how to design a trial so that those of you who are eligible and want to participate are going to be able to go through the level of testing or the number of visits. I'm very pleased to say that late last year we joined a new national initiative to develop biomarkers for Alzheimer's and other forms of dementia. It's called the Diagnostics Accelerator. And again, we're increasingly in the rooms with more powerful people. So Bill Gates and Jeff Bezos are both co-funders in that program. And we have convinced the group that at least $5 million of that pool of money will specifically go to the FTD biomarker programs. And again, these are places where people are learning that there are different forms of dementia. And finally, my staff and I are represented on 9 different national committees. And again, this is important because these are federal committees that are working to develop policy and new programs, design new research programs. And again, we're in that room, ever the squeaky wheel, making sure that they understand that not all dementia happens over age 65 and not all dementia looks like a memory disorder. So it's against this backdrop of momentum, and with input from many of you in this room, that the board and staff spent much of the past year crafting a strategy that will guide our actions for the next 3 years. It's an ambitious plan. Last night, somebody actually used the word audacious, and I kind of like that. Big problems call for big solutions. So I invite each of you to find the plan on the website and tell us what you think. What I'm going to do over the next couple minutes is just to walk you through some of the highlights. The plan is built on 4 major goals, each of them incorporating elements of our work to support people living with this disease today and providing hope for a future without FTD. Goal 1 is to advance early and accurate diagnosis and the development of treatments. We're going to do this in a number of ways. We're going to continue to fund the best science from around the globe, attracting promising young scientists to work in FTD, continuing to focus on the development of FTD biomarkers, and inspiring creative approaches to clinical trial designs. We're going to stimulate and lead new partnerships and collaborative initiatives to accelerate the development of FTD diagnostics and treatments by convening scientific meetings, supporting clinical FTD networks like Artful and Lefties that we heard about this morning, collaborating with other funders, as we are in the Diagnostics Accelerator, and encouraging and even requiring data sharing to ensure that FTD as a field can build a repository of knowledge from one study to the next. We're going to educate healthcare professionals so more doctors have FTD as a possible diagnosis in the back of their minds when they evaluate a person, and so that they know where to refer for an expert evaluation. And through programs like the FTD Disorders Registry, we will empower each of you and those in our broader community to play a role in advancing research. Goal 2 is to advance quality care and support. We plan to expand the reach and impact of AFTD's direct support services, piloting tactics to connect our helpline callers to local resources available to you in your own communities. We're going to create new resources to enable people with FTD and their care partners to maximize their quality of life. We'll continue to expand the number of support groups across the country and explore and address the needs of underserved members of our community. We will train and equip volunteers to educate healthcare providers in their own communities that not all dementia looks like Alzheimer's, and that people with FTD may require different strategies for quality care. And finally, we will focus our advocacy efforts at the national level, where, as I alluded to before, there are a number of initiatives to expand care and services for those living with dementia, But we aim to be in the room where policies are being written, ensuring that new programs include coverage for people under the age of 65, as well as those whose symptoms may present as language or behavior or personality change or movement, rather than a memory disorder. Goal 3 is to strengthen and expand AFTD's position as the leading authority on FTD. We'll work hard to ensure that we are the place with the most up-to-date and accurate information on the disease. We're going to deepen our marketing and outreach efforts to reach more people in need of our services and to spread broader awareness of FTD. And key to most everything you hear in this plan is a dramatic expansion in the scope and impact of our volunteer program, with information, materials, and training that will expand our army of volunteers across the country and ensure that each person has the opportunity to engage and make a maximum difference. And finally, Goal 4 is to build and strengthen the organization for long-term success. We know that we have aspirational goals, and that if we are to succeed, we need to invest in AFTD's core strength to ensure our ultimate success. This is a marathon, not a sprint. With this in mind, Goal 4 calls on us to invest in technology, in the professional development of our staff, and in ensuring that our board governance is in touch with and can proactively meet the needs of the organization and of our community. So as I said in the beginning, it's an ambitious plan. Over the next 3.5 years, it calls for a dramatic expansion in our staff from 20 to 30 full-time professionals. And it calls for an investment of more than $30 million over 3.5 years. Now, I've been here for 11 years, and that last sentence is one that I would not have dreamed of saying even 5 years ago. But our plans are anchored by the very generous commitment of two important benefactors, the David Geffen Foundation and the Samuel I. Newhouse Foundation, each of which has pledged $1 million per year for 10 years in support of our mission. You guys are jumping the gun. I was going to say, for the first time, we have representatives from both of these foundations in the room today, and I want to invite you all to help me convey to them just how much the David Geffen Fund at AFTD means to our community. The Geffen Fund gives us resources to grow and expand AFTD's mission. But even $20 million over a period of 10 years will not be sufficient to support this ambitious plan. The fuel for our work moving forward is not only from large gifts, but also from the thousands of donors, volunteers, and fundraisers who support and drive our work each year. Last year, AFTD received donations from more than 11,000 people. Some were gifts of $5 or $25. Others were much larger. About 60 of you in the room today donated to help provide free registration for others to join us at today's conference. Every gift in support of AFTD, every fundraiser held across the country brings hope and help to our community, and we are so very grateful. So I encourage you to read the plan. You can find it on our website. As I said, that will guide our work for over the next few years, and I invite each and every one of you to engage with us to realize our vision. And I don't usually get to end my talks with late-breaking news, so this is very exciting for all of us, I know. As we know, another crucial way to contribute to this work is by sharing our stories. We've heard so many powerful stories this morning, and we're about to hear one more. There's power in the stories each of you in the room here today has to share. And I'm very excited to announce that this Sunday, 60 Minutes is airing a story on FTD. My staff and I have been working with 60 Minutes producers for the past several months to provide them with accurate information on FTD and to introduce them to members of this community, some of whom featured in this piece you'll see Sunday night are with us in the room today. So please spread the word to your family and friends and tune into CBS this Sunday night for 60 Minutes. Thank you so much.